Hi, and welcome to this presentation on grief in its uncomplicated and complicated forms. My name is Cindy Rowe, and I'm an MSW student at Marywood University. And in this segment, we will be looking at some of the key principles in helping clients as they work through their grief, as well as some of the different things that can interfere with grieving, as well as what practitioners should look for in determining if a client is struggling with their grief. To begin with, it's important that we understand the distinction between grief counseling and grief therapy. Grief counseling involves helping someone work through the various tasks of bereavement so they can experience a sense of healing from their grief, as well as helping them to adjust to the changes that happen in their lives due to their loved one's death. Grief therapy, on the other hand, this involves aiding the client in identifying and resolving things relating to their separation from and the relationship with the deceased loved one that interferes with their ability to work through their grief. So a key part of this involves conducting a thorough assessment of the client before the grief work is started in order to identify if the client has for example, a comorbid condition such as a personality disorder or a depressive illness that needs to be given more extensive support, because these conditions can seriously impair the client's overall level of functioning and thus interfere with their grieving. Some key principles in supporting clients through the grief process include helping them accept the reality of the loss and talk about it. And this is the first task of the grief process that Warden's proposed in his task model of grief. Helping them identify and express their feelings is the second task in this model. People commonly feel anger, which can be deflected onto others or turned inward. Anger can mask other feelings like guilt, as well as depression and self-esteem issues. So it's vital that social workers and clinicians probe a little about suicide ideation and suicide behaviors with clients, because grieving can trigger depression to such an extent that the client could be at risk for harming themselves. One way of encouraging the client to elaborate on their feelings is to ask them what they miss about their loved one, and then couple that with asking them about what they don't miss about their loved one. And by doing this and encouraging the client to elaborate, this can help them see that they have both positive and negative feelings, and that's normal. Feelings of guilt are also common, particularly in those grieving a suicide death. While some guilt has a basis in reality and is much harder to work through, most feelings of guilt are irrational. Reality testing, where the social worker asks the client who says that they didn't do enough to describe in detail each thing that the person did do to help their loved one, which can help the client realize that they probably did do all that they could. The use of psychodrama, which is a form of role play that lets the client play the part of every person in a situation, this is another technique that helps broaden their perspective, and it can also be a very useful technique. And anxiety is yet another common emotion inherent to grief. Again, it's important for the clinician to normalize the client's feelings, because anxiety is a normal response that arises from being separated from your loved one. Since anxiety can arise from a sense of helplessness, the clinician can help the client recognize the ways that they were able to manage on their own before their loved one passed away. For children, they can do this by reassuring them that they will be taken care of. Helping the client work through their separation anxiety also is reflected in the third task of grieving, that of creating a new life without the deceased. It's important for the bereft person to give themselves adequate time to grieve. This involves not rushing in to make drastic changes to their lifestyle too soon. Also, helping the client address their questions of why. Why did this happen? And why did this happen to me? Those help them find meaning in their loss. Also important to the grief process is helping the client find ways to remember the deceased, which is task 4 of Worden's model. Lastly, being mindful that grieving is a highly personal process and interpreting normal and problematic behaviors is essential because it's as connecting the client with other resources as they are needed. Those are also key aspects of culturally and spiritually sensitive practice. In turning our focus to aspects that interfere with the grief process, the first one that comes to mind is the type of relationship the client had with the deceased. A relationship that had a lot of conflict, ambivalence, or even hostility commonly makes grieving harder for the surviving person. When a family member dies, any issues of family estrangement, for example, they often come to the forefront since death and dying tend to kick up old wounds in people who had poor quality relationships with the deceased person, since they might grieve for the love and acceptance that they didn't get from that person, and for the fact that they will never get that sense of validation and love from the deceased person. Uncertainty surrounding the person's death is another factor of complicated mourning. Examples of this include combat soldiers who go missing in action or missing persons. In these instances, survivors are unable to adequately grieve, or they grieve and accept the loss only to find out much later that their loved one is still alive. And the opposite of this is what's referred to as inconclusive mourning. This is where the bereft, they firmly believe that their loved one is still alive. This goes back to the example of the dual process model that we discussed earlier, that of holding out hope versus facing the reality of the situation. Some important social factors can also complicate a person's grief, such as if the death is socially unacceptable or stigmatized. This is common in situation of AIDS deaths and suicide. Some disenfranchised deaths, such as miscarriages, stillborn births, and SIDS, as discussed previously in other segments, they might be looked upon as less important types of deaths by other people. And this can leave the grieving person feeling like they lack the support of others. And the support of others, as we've seen, is yet another aspect of complicated grief. Grief researcher J. William Worden suggests a paradigm for complicated mourning, which can involve chronic grief reactions, delayed grief reactions, exaggerated grief reactions, and masked grief reactions. So in chronic type reactions, the person knows their grief is problematic. In fact, oftentimes clients will seek out help with their grief because they feel like they're stuck somehow in the grief process. In addition to grieving that never gets resolved, chronic grief reactions can be excessively long. So intervening for this type of grief involves identifying which of the tasks of grief aren't being resolved and what mediators of mourning might be impacting that, and working with the client to help resolve those issues. So for those with delayed grief reactions, grief to the first loss is very minimal. And then with subsequent losses, their grief responses are then excessive. So there's an imbalance in their reaction to the stimulus and their response to it, basically. This is fairly common, for example, with soldiers in the field who lose a buddy in combat, but because they're still out there and they still have to carry on their mission, they just have to put the loss out of their mind. They can't adequately grieve their loss. So when the next loss comes along, their grief reaction to that subsequent loss can be much more intense and excessive in relation to the situation. In exaggerated grief, the person is well aware that their grief is problematic, so they also might seek out counseling or therapy because they're having problems with their daily functioning. Major depressive illness, that's one form of exaggerated grief because that can develop after loss due to somebody's death. Masked grief reactions. These are challenging for people because they are unlikely to recognize the connection between the symptoms and their grief. This confusion is often due to the fact that their grief manifests as other physical or somatic symptoms or some other sort of maladaptive behavior. So the person would go to therapy for a completely different reason, and through their work with the therapist, that's when the connections to the unresolved grief come to the forefront. As we saw earlier, sometimes diagnosing complicated grief is pretty straightforward for those clients who seek out the help because they feel that they aren't coming to closure in mourning somebody, or they recognize that their grief reactions, they're out of proportion to a particular loss, right? Other times, clinicians, they will have to do a little more probing in order to determine if unresolved grief is involved with the client's physical or behavioral issues, like we just said. So some of the things that social workers and clinicians are looking for are if even talking about the loved one for the client triggers some fresh, intense grief. If minor losses spur reactions that are out of proportion, or if the clinician starts to sense and see some themes of loss coming up during the initial intake with the client. Also, the client might be unwilling to part with the loved one's belongings. They may have made swift, radical changes to their lifestyle or in their relationships with close family members and friends, which this is a sign that they could be distancing themselves, right? As noted earlier, having a history of depressive illness or certain types of personality disorders can also be a risk factor that we need to be on the lookout for, as are the compulsion to imitate the deceased person or engaging in impulsive, maladaptive behaviors. Lastly, while feeling sad around the time that their loved one died is pretty normal in the first year or two after death, experiencing this for many, many years afterward, that can also indicate the complication of grief, as well as having phobias about illness or death. So this concludes this presentation, and if you're interested in learning more about death and grief in the context of social work and the helping professions, you can visit my YouTube channel where you can see presentations on other topics. Thanks again for watching.